Good morning. Welcome to my YouTube channel, Heart Talk with Doc G, it is called. And for this episode 6, I'm happy to have with me Dr. Nigel Santos.
Good morning, ma'am.
Good morning, Nigel. Thank you. Thank you sa pagpapaunlak mo sa aking invite. I know super busy ka. Our topic for discussion is insights from ground zero. So from the term itself, ground zero, it gives you ideas of war, of catastrophic events, and it does feel like war sometimes. I often think of it as the war of our generation and something that hopefully we can emerge from victorious, better humans. And I think that's key, yung being better humans kasi madali naman maging magaling, pero mas mahirap maging magaling na tao din. So let's get the ball rolling, Nigel. I will ask you your first question. What is the situation on ground zero?
Okay, ma'am. So again, thank you for inviting me. Just for the audience to know, I am the current chief resident of the Department of Medicine in UPPGH. So the Department of Medicine po, yun po yung specialty specifically sa mga matatanda, no? 18 years old and above na humahawak sa mga pasyenteng may malalang COVID-19 or may COVID-19 in general. I agree with the statement niyo, ma'am, na ground zero kasi nga we've been in this already for so long, and yeah, it does feel like a war sometimes, but being in PGH for 4 to 5 years now, and in this pandemic for almost 2 years already, I do feel that there is some improvement. Iba po yung challenges ngayon compared sa challenges last year. Ang challenges po natin last year was nung unang sumabog yung COVID-19 at naging COVID referral center yung PGH. Ang problema natin nun more on supply ng PPE, yung takot ng mga tao on how to handle COVID-19 kasi parang bagong sakit siya, so parang konti lang talaga yung, hindi naman sa konti pero yung mga tao parang hindi pa sila ganun kasigurado para sa safety or seguridad nila. Pati na din yung mga gamot, no? Wala pa tayong definite na gamot nung nag-start yung pandemic last year. Parang I remember people were pushing for like say hydroxychloroquine or kung ano mang maibigay na gamot. But now, yung at that aspect, I think naging better. We do have studies now on COVID-19, what can help us combat the disease, especially for severe to critical patients. Ang dami ng trials na good quality. In fact, since the pandemic, we already have multiple guidelines in the Philippines alone. We have 2, one from PISMID and the other one is the living recommendation. So napakalaking tulong po nun sa mga doktor nating humahawak kahit hindi sa internal medicine kasi natututo din silang maggamot ng COVID-19. At syempre po yung supply ng gamot, meron na ngayon kasi alam na natin kung ano yung mga dapat natin sinastock sa hospital. Yung sumunod na improvement po siguro yung pinakainabangan natin ng mga vaccine, meron na tayo sa PGH. So at least meron tayong additional protection sa ating mga sundalo or frontliners mismo. So I think mas yung problems po ngayon ay parang bumalik na naman tayo sa isang surge. Itong surge na to, more difficult ito than last year kasi I think definitely mas mataas yung numbers. And then syempre yung workers po natin, nafa-fatigue na din po sila. Napapagod na din kasi parang they've been doing this for so long already. I mean, before we had a vision to look to na at the end of the pandemic, makakauwi ka sa parang sa pamilya mo pag-vaccinate na sana lahat. Hopefully, di ba, bumababa na po yung numbers neto the early part of the year, and we were planning already for the new normal, but then this came again. So parang siguro nagkakaroon lang ng mga doubt yung mga tao kung may katapusan pa, kung may katapusan pa po ba ito. Parang no one can answer that. So I think yon, and of course iba po mag-duty ngayon compared sa kung mag-duty yung mga healthcare workers dati. To be a resident or a doctor now, napakahirap kasi dati kung mag-duty ka, pagod ka, parang ina-expect mo na yun lang rin naman yung gagawin mo for the next few days, parang paulit-ulit lang, madaming pasyente, pero you see a vision at the end of it. But now may dagdag pang factor na, of course, you're thinking about your safety as well, you're thinking about the safety of your family, ayun, and then yun nga, yung end in sight, parang people are losing what the vision is on how this pandemic will end. So I think yun, and also burnout.
Bigyan mo nga sila idea, Nigel. What does it feel like to go on COVID duty? Ano yung mga insights mo pag nag-duty? Ano yung experience mo, first of all, as a healthcare worker and as a leader of the healthcare workers? And ano yung mga insights na nag-gain mo from those experiences?
So siguro sample of how residents day goes about, siguro better siguro if sa mga COVID wards, kasi yun talaga yung COVID wards in sa ER, so they usually go in at 5 or 6 a.m. Every day. So pagdating nila doon sa area kung saan sila naka-assign, i-run down muna nila lahat ng pasyente doon sa outgoing team para po kilala ng mga doktor at nurse lahat ng mga pasyente na nandoon sa area na yon, sino yung pumasok nung gabi, kung meron pong namatay o nag-toxic. So usually lahat po yun sa umaga, and then they wear the PPE. So yung PPE po ay personal protective equipment, kasama na po dito yung N95 mask, no, makapal na mask po yun para hindi pumasok yung virus. Meron din yung face shield, and then merong parang suit na tinatawag or gown. Tapos footwear covering and gloves. So if you can imagine, in a tropical country, napakainit po talaga noon. And then usually they go in, shift lasts for 8 hours. So at any given time, siguro at least 4 to 8 hours silang nakasuot ng PPE, iikot sa pasyente, ibibigay yung gamot, syempre kakamustahin sila, and then pagkatapos po nila lumabas, salitan po yun, what they do is that they adjust kung may kailangan gamot na kailangan idagdag, kung may kailangan taasan. And then of course, kasama din doon is that they document everything, tatapusin lahat ng papeles. And then also, mas yung additional challenge din now is i-update mo pa yung family, so tatawagan mo pa yun isa-isa. Minsan parang makikitawag pa po sila sa barangay para lang ma-update o magpapatulong sa social services. Minsan meron pa tayong tinatawag na na parang Zoom call. Sineset up po yan sa PGH ngayon. May program na at least yung family makakapag-usap sila with the patients while inside the COVID ward through a computer interface. Especially ma'am if critical na yung pasyente.
Yes.
Parang 'di ba, you would want na kasama mo yung pamilya mo during the last seconds. So syempre parang ang normal situation ngayon ay talagang naka-hold up lang yung doktor or yung nurse ng cellphone, tapos doon lang nila na napapakinggan or nagsasalita lang sila. Ako personally na-experience ko yon na kinakantahan pa on the last few moments, parang mga ganyan.
Grabe, no? Parang ibang klaseng experience.
Nakakaintig po talaga.
So anong mga insights ang nakuha mo sa lahat ng pinagdaanan mo na yon? Meron ka bang realizations or mga naisip na dati hindi mo naiisip?
Well, actually, dun ko mas na-realize how amazing humanity can be. When you're put in a situation that is so extreme that you can only imagine it, parang ganun, and you're placed in that situation, parang sometimes you're amazed at how people respond. Parang they, even if they're tired, they still try to give the best that they could for the loved ones of other people, the patients that they see. But of course, I also realized that um, everyone has a limit, and I think that limit has to be respected. I mean, our resources are finite, our emotional well-being and our mental health is equally as important, if not more important than, the physical well-being.
Mm-mm.
And that should really be um, taken account by the leaders um, who are steering us through this pandemic. I mean, sometimes parang people really fall, hindi naman po sa pero I mean in general, among all countries, administrators really fall into the trap of looking at numbers more. Di ba ma'am? Parang
Mm-mm.
that's one resident. That resident can manage so and so number of patients, but
Mm-mm.
they don't see the story behind that resident. That resident had a mom who had COVID and is going through a lot. And even if that resident is like the smartest person in the world, smartest person in that batch, parang the toll of the pandemic and not being emotionally and mentally well can really affect how they manage patients. So I think that should be prioritized as well.
Understandably so. And if you think of it, the burden on the healthcare workers is double, because you have your family, you have yourself, but you have to care. Our oath is to really serve, diba? So sometimes you really have to put yourself second. But you are right, there is a limit. You have to care for yourself because you cannot deliver optimal care if you are weary, if you are not whole, if you are grieving still. People should be allowed that space and that time. Final question for you, Nigel. Situation. The pandemic looks like it will be here to stay for a little longer, no? But there's a way to move forward, I believe.
Yeah.
And I would like to ask you what your insights are on this.
Definitely for the population, everyone I think who is eligible to get a vaccine should be vaccinated for COVID-19. Uh, you know, that's that's a must for everyone. Parang I don't see any other reason why you shouldn't be vaccinated. It's for you, it's for your family. Parang it's the best investment that you can get right now. And then second would be
Hang on, Nigel.
yes,
What
ma'am.
about being vaccinated, not just for you and your family, but for the community as a whole? And also
Yeah,
for the healthcare workers, kaya can we ask them that na maybe to help ease the burden on the healthcare system, we
yeah,
can all do that, pitch our part,
yeah, parang do your part for the community. Kasi
right?
parang the vaccination really does help decrease the transmission o uh, para sa madla hindi napapanatili po niyang mababa o napapababa niya pa po ang pagkalat ng
Oo.
COVID-19. So talagang yun na yung pinaka mabuting paraan para makatulong kayo hindi lang sa pamilya ninyo pero na rin sa kapwa. Kasi ang goal nga po natin para matapos ang pandemyang ito ay dapat halos lahat ng populasyon ay nabigyan ng vaccine laban sa COVID-19. At kung kayo po ay talagang nababagot na, kung may katapusan pa po ba ito, mas mapapabilis nating maabot yung katapusan ng COVID-19 kung
Kung
mababakuna
lahat, kung
lahat.
lahat magpapabakuna. And paano naman yung nagsasabi na, tinan mo, yung mga navavaccinate, na-infect pa rin naman sila. Anong masasabi mo doon?
Ang vaccine ay una, pwede po niyang mapigilan na magkaroon ka ng infection in the first place, or if magka-infection po kayo ng sakit na yon, hindi po ganoon kalala ang infection na
Mm-mm.
madedevelop ninyo.
So anyway, ano pang iba mong insights on how to move forward aside from the vaccine?
If also for the parang everyone now, even if you're vaccinated, you shouldn't forget to wear your masks and observe proper infection control strategy. So ibig sabihin po nun yung tamang pagsuot ng mask, dapat talagang natatakpan yung ilong pati yung
Mm-mm.
bibig. 'Di ba,
Mhm.
napaka-common po niyan sa Pilipinas, pag naiinitan ibababa ng konti, pag may kausap
Mm.
doon pa nga po kayo mas lalo makakahawa pag binaba ninyo at nagsalita kayo, kasi yung droplets o yung maliliit na laway at hininga ninyo, yun po yung talagang nakaka-infect. And second of all, kung yung distancing ninyo sa ibang tao, dapat 2 meters apart po talaga, kasi at that distance, mas maliit na daw po ang posibilidad na mahawa kayo sa COVID. In terms of systems and how we manage this pandemic, siguro ang naiisip ko po talaga ay yung proper compensation ng healthcare workers natin. I mean, we've talked about before na talagang fatigue na sila, prone na sila to burnout, yung risk na dinadala nila not just for themselves pati sa family na inuuwian nila. That's something that healthcare workers weren't so at risk for before. And we are in a crisis now. So I think as much as possible, the funds should be prioritized to the people who are really there in the front lines of your crisis.
So may iba ka pa bang naisip na
Yung isa ko pa
insights?
naisip, I know everyone now is to online shopping in Lazada, pero ako na-surprise lang ako na tinatangkilik talaga natin yung mga Korean masks, ma'am. Di ba parang
Oo.
ganda kasi yung design, Korean
Oo.
masks,
Oo.
thin masks, we really look for those. But parang ako na-surprise lang ako na, di ba, Filipinos are very crafty. I think hindi naman siya beyond our competencies to create personal protective equipment of our own. I think that's a thing that's a two birds with one stone thing. If you empower the local businesses and local manufacturers to be the ones to provide us or supply us with these masks. I mean, I know there are some, but I think there's still a long way to go for us to be independent, at least in terms of healthcare costs for the whole country when it comes to masks.
Anong pwede nilang, hindi, unang-una, lahat ba ng pasyente kailangan magpa-ospital? Sino yung kailangan na talagang ma-ospital? Anong pwede nilang gawin sa bahay? Let's say, hindi sila ma-admit sa ospital.
So, actually, for yung kailangan po siguro malaman ng general public for COVID mild to moderate, ibig sabihin yung level ng infection mo ay hindi ganoon kalala. Paano mo masabi yun? Hindi bumababa yung oxygen levels mo. Oxygen levels po makukuha yun using a gadget which we call pulse oximeter. Tapos yung sintomas sa COVID, like parang karaniwang sintomas lang rin po siya halos ng punag. Sinisipon, inuubo, nilalagnat, nagtatae, pangit yung pakiramdam. Pag may ganun kayong sintomas, ang unang-una ay mag-isolate kayo. Pangalawa ay magmo-monitor kayo. Kung una dyan ay temperature, and mas importante doon ay yung oxygen levels po sa blood ninyo. Ang target po ninyo, dapat 92% and above yung oxygen level ninyo. If bumababa doon o nahihirapan kayong huminga, yun talaga yung panahon na kailangan nyo nang magpa-hospital. So, malaking maitutulong po noon sa mga pila sa ospital, kasi kung may iba po kasing pasyente na kaya nilang gumaling sa COVID na nasa bahay lamang kung hindi malala yung infection po nila. Pero definitely kung malala, nahihirapan huminga, nawalan ng malay, sobrang sakit ng dibdib, bumababa yung oxygen levels ninyo, suka kayo ng suka, hindi na kayo makakain, yun talaga yung kailangan nyo nang magpa-admit sa ospital.
Anong pwedeng gawin? Anong home remedies for yung mga mild to moderate? Is there anything they can do to improve the outcome?
I think ang importante dyan ay yung symptomatic treatment, meaning kung ikaw ay nilalagnat, pwede kang uminom ng gamot para pababain ng lagnat mo tulad ng mga over-the-counter medications like paracetamol. Kung may sore throat ka, pwede ka ding yung oral gargles na antibacterial.
Or yung alam mo yung seawater spray, humor, yung isa sa
parang
ginagamit ko.
saline. Opo.
Saline spray. Para rin yun yung mga nagmumumog ng
Asin.
tubig na may
Sa
asin.
tubig yan.
Oo.
So sabi nga rin ng mga pasyente namin through telemed, nakakatulong nga rin po yung ganun. Meron po kasi mga pasyente na talagang hindi naman na nila kailangan magpa-admit. Pero like I said, kung meron sila nung mga sintomas na sinabi ko or meron silang iba pang sakit,
comorbidities.
Comorbidities, matanda, 65 years old and above, comorbidities, may sakit sa puso, diabetic, high blood, iba pang...
Yun yung mga kailangan i-prioritize na i-admit.
Yes.
Pero let's say, realistically, let's say gusto nila magpa-admit, wala silang mahanap na bed kahit saan, tas may symptoms na sila and bumababa na yung oxygen nila. Is there any stopgap measure that they can do at home aside from putting on oxygen?
They can do proning at home. So definitely you still have to call the one hospital command center. Yun po yung sa parang
pumila na.
Pumila na kayo kasi definitely matagal po ang pila dahil nga search po tayo ngayon. Pero kung habang nasa bahay po kayo, ang mismong pagdapa, makakatulong po ito para po yung mga ibang parte ng baga ninyo sa may likod ay yun po yung lahat po ng parte ng baga ninyo ay magagamit ninyo at magagamit ninyo para mapataas yung level ng oxygen po ninyo. So yung pagdapa,
Pagdapa. Pero yung mga steroid, dexamethasone, hindi yun dapat i-start sa bahay.
Yes po. Dahil una dapat po doktor ang mag-reseta po nito sa inyo. Kasi ito po ay kahit pa sabihin nating steroid siya, ito po ay isang steroid na high potency o malakas.
Matapang na steroid.
So, pwede po siyang magdulot ng mga side effects na baka hindi po kaya ng normal na tao o pasyente na walang medical background na i-manage at home.
I guess, Nigel, ang isang pwedeng supervision na pwedeng mangyari is marami naman nagte-telemedicine na doctors na pwedeng mag-guide sa patients na nasa bahay.
Yes.
Sa final question, ano naman ma-offer ng PGH to other doctors in order to increase the level of awareness and baka may updates galing sa PGH? You mentioned earlier research, di ba? Mismong PGH is conducting COVID-related researches. Anong ma-offer natin?
I think isa rin tong sagot, ma'am, doon sa tinanong nyo kanina, yung how we can move forward. I think there should be measures in place on how to combat the misinformation pandemic. Parang ngayon, magbukas ka lang ng social media, Facebook, Instagram, TikTok, YouTube, napakadami na dyang mababasang impormasyon tungkol sa health, wellness, COVID, na minsan kung wala akong medical background, hindi ko din alam kung saan ako maniniwala. And that's not just for patients but also for doctors. In this pandemic, parang people really have to realize that they have to be able to discern which information they can trust.
Oo.
So I think that's the strength of PGH, is it's at the forefront of research in the Philippines. I mean, our experts are always so innovative. There are several clinical trials ongoing now or have recently finished, the results of which will be presented in one of our upcoming postgraduate conferences. And of course, the information that PGH gives, yung mga different subspecialties on how this pandemic has changed their day-to-day practice, how they treat the patients now and diagnose the patients now. That's something that we can offer, and you can stay in tune to in our upcoming postgraduate conference. So we have an upcoming second Philippine Internal Medicine Summit entitled EPIC. So emerging practices in clinical practice,
Insights and concepts.
insights and concepts in
Mm-mm.
internal medicine. This will be this November 5 to 6 and 12 to 13. We have a roster of experts, consultants, and even non-medical professionals who will be there, including public leaders such as, pwede na ba i-announce mo? Sino? Hindi
Mm-mm.
pa.
Yes.
Sina Boy Abunda,
Mhm.
as well as public health leaders like Vico Soto, who will be sharing their experiences as well on the upcoming summit. So we'd like to invite all the doctors, medical doctors who's interested in these clinical practice changing updates.
I would just like to take pause and remind everybody that there is an end in sight. The Spanish pandemic lasted for years as well. And strangely, it was only when one observation was when they brought the beds out, aired them, and exposed them to sunlight, that uh, that the figures improved. But also, 56 million people worldwide died during that pandemic. And so it is with a lot of mindfulness that we would like to approach our own pandemic. But as Nigel says, there's a way forward. So thank you, everyone. If you haven't, please subscribe to my channel, Doc G Gervasio. See you next time for the next episode of Heart Talk with Doc G. Thank you, everyone.